Hello, Dr. Davis. This is student Dr. Peng. I choose the first case as my oral case presentation. Uh, Ezra Carter is a 16-day-old male presenting for a routine newborn visit with his parents. His parents report that the infant cries at night and wakes up every 2 to 3 hours. They also have concerns about baby's feeding. He is exclusively breastfed, but latches only for a couple seconds at a time and does does not appear to be satisfied. Um, Infant's mother denies any nipple pains after the feeding, and the baby was fed 10 to 12 times a day and has 6 to 8 white diapers and 3 bowel movement daily. Um, they are also concerned because the baby was jaundiced at birth, but he hasn't shown any signs of jaundice since discharge. The baby's growth parameters for the weight, he's on the lower side with 3.4 kilogram, which is 15th percentile for his age. His length was 54 centimeter, which is 79th percentile for his age, and head circumference was 35 centimeter, which is 20th percentile for his age. On examination, the baby is sleeping comfortably. During the exam, his vital signs are normal for his age, with temperature of 98.6, heart rate of 130, respiration rate 40, and blood pressure 80 over 50, and oxygen saturation 98% in room air. The HEENT finding include a open, soft, and flat frontalis with no cephalohematoma and no cranial stenosis. He has intact palatine palate and bilateral red reflex with no scleral ectasis. His lung sounds are clear bilaterally, and cardiovascular exam review a normal S1, S2 heart sound with no murmur. He has a strong and equal brachial and femoral pulses. His abdomen is soft, and the bowel sounds are present in all quadrants. The GU exam shows Tanner 1 stage with no hernia. Um, the infant's skin is pink, warm, and dry with no rashes, and the infant has full range of motion in all extremities. My assessment is that either is a healthy newborn with some feeding challenges, likely related to some latching problem. Uh, Izar's parents also has concern about his sleeping pattern as well as his jaundice after delivery. So the plan for the feeding is to get a referral for lactation consultant, provide some guidance on breastfeeding technique, and a close follow-up in 1 week to assess the feeding progress and monitor the Izar's weight gain. I provide education for the parents to continue to monitor for the number of wet diaper and bowel movement because a low uh, number of wet diaper may indicate dehydration. Uh, for the sleeping pattern, I provide some teaching for crib and sleep safety, such as always place the baby on his back to sleep on a firm flat surface, um, and using a tight feeding sheets for the crib, and always keep the sleeping area free of soft objects such as pillow, blanket, or toy to reduce the risk of suffocation. Um, I reassure the parents that it's normal for infant at this age to wake up every couple hours at night, um, because the newborn has a smaller stomach and needs to be fed frequently. Um, so for them to wake up at night, it may simply just because they are hungry and they haven't developed a consistent day to night rhythm. As baby grows, their sleeping pattern will become more predictable. I provide some teaching regarding the jaundice. I reassure the parents that the jaundice is common in newborn, um, that causing yellowing of the skin and eye because of a high bilirubin level, and it usually goes away in the first few days as baby's liver mature. However, I made sure that to educate the parents that if his jaundice returns again, to let us know immediately. I reminded Izar's parents that the next wellness visit will be at 2 months, and Izar will receive several important vaccines, including first dose of DTaP and Haemophilus influenza type B, polio, and PCV13 for pneumococcal vaccine, and rotavirus vaccine, and second dosage of hepatitis B vaccine. Uh, I provided some education on the key milestone that um, the parents can expect to see from now until 2 months. For movement, um, the baby may start to lift their head during tummy time, because of their neck muscle are getting stronger, and they can start move their arm and leg more smoothly. For visions, the baby will begin to track objects with their eyes and may focus on faces or high contrast pictures. And they can provide some like black and white card for the baby to look at. And for hearing, the baby will respond to familiar sound and noises, and he may start to make cooling sounds and attempt to communicate. Um, and for reflex, the baby um, can grabbing the fingers, and they may get stronger, and they may start to move the finger to their mouth. Um, Again, I just made sure to reassure the parents that at this stage, the baby frequently waking up, it's very normal, and just provide some guidance on the feeding, and make sure to follow up with the parents. That concludes my oral case presentation. Thank you.